Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast, brought to you by RipsyTech. I am one of your hosts, RipsyTech product manager Parker Anderson, and as always, I am joined by RipsyTech founder and CEO, the magnificent Tom Tarshis. Hi, Tom.
Hey, Parker. Good to see you. And this is a reminder that maybe next week I can try doing the intro.
Ah, that's right. That's right.
That'd be a fun challenge for me.
Well, the word of the week is magnificent. So, for this week's episode of the podcast, we wanted to talk specifically about Scribe services. That's something we haven't really talked about. Something that I have only experienced with a medical professional recently. Personally, never experienced with any kind of mental health visit. Let's talk about what Scribe services are. Go ahead.
Yeah, and there's two types really. One began actually a number of years ago, like maybe even as many as 10 or 15 years ago, and that's where there's another person either live in the room or live via speakerphone, and they're listening in to what's happening in the visit, and then they're actually trained to write a medical note that corresponds to the visit. And then it is up to the clinician to review the note and sign off on it. But you can imagine that someone could get pretty good at learning what a medical note should look like and being there in the visit. And then for doctors, I think this came about a lot for some of the doctor groups where they work their clinicians pretty intensely. And with the advent of electronic health records and people who were not very computer savvy, this was a way to maybe avoid mass departures, appeal to people to stay on board. And that's how Scribe services started. I think what's happened recently with the explosion of AI now is that there are dozens, if not hundreds, of AI Scribe startups that have launched. I think it's fair to say they could all be classified as startups given the time frame we're at. Mm-hmm. And then we do still see, or I don't know if I've seen the speakerphone Scribe service. I know they still do exist, or the remote listening services, but at this point, I think a lot of that has started to and will be replaced by AI Scribe services. So I think that speakerphone type listening position is going to be going away.
That makes a lot of sense. I just in learning about it and that dynamic of having somebody kind of on the phone who you don't even see listening to your medical visit sounds a little, I don't know, that me personally, I'd feel weird about it. But I mean, it certainly wouldn't, if the doctor said, hey, I have this, I'd say, okay, cool. But it would be a little weird. But I think definitely with the advent of AI and being able to record a conversation and write down the notes, I think that everything you're saying makes a ton of sense. I would feel less weird about that. Certainly as a patient, I'd be wondering, hey, where does this recording go? But that's a whole other conversation probably. So let's talk about that weird feeling that I was just kind of talking about. I mean, when it comes to Scribe services, how does that affect the interactions between the patient and the provider? And might there be any concerns about privacy or the comfort of the patient?
Yeah, and we can talk about it also like with specific, paying attention to mental health visits, which are unique by themselves. But I'll say I was just at my primary care doctor's office, and I was sitting in the waiting room, and they are using AI service, and so the front desk people get permission, or they ask the patients to sign something saying they're okay with a AI Scribe service, and they were describing it to someone. I didn't look at who the patient was, but it was someone at the counter, and we're asking if they could have permission. And the patient said, "So you mean it's like recording everything? And where's that recording going?" And the patient actually didn't. It's an interesting story. They didn't really feel comfortable with it. And so they said, but I think not at this time. But then there was a little other dialogue I didn't completely hear. And the patient said, "Oh, so this helps save my doctor time and helps save my doctor work. Okay, all right, we can do it." So it's a very interesting. It's just an intellectual thought process with different ethical implications. I will say in our own clinic, so we started experimenting with AI services maybe 6 months ago or so.
Right.
And initially we didn't have it in our office policies. And so we would ask every patient how they felt about the recording the session and using an AI service. I'd say about 85, 90% of patients were okay with it. I think that we did a pretty good job of explaining the HIPAA protections, what happens with the recording, what happens with the note. And however, given that every other week we're seeing a security breach, there was a big patient mental health records exposed, I could see where there would be valid hesitation in not wanting to use the AI service. What we did since then is we have actually built it into our office policies, highlighted that we do use an AI service, and that if you don't want to use it, you need to let us know. So we sort of have the permission built into the office policies. Hopefully people are looking at it. It's something they have to initial. But then we also, of course, do know that people don't necessarily read the office policies very well.
I think at least making it a point that they have to initial specifically as opposed to just some universal signature at the bottom is probably a better way to go about putting something like that in your office policies if it's something that you feel a patient might want to opt out of.
Yeah. And I know... I'll say for myself, I'm not actually totally sure how much time it saves me.
Oh, interesting.
I think, and as you know, Parker, we're looking at different AI companies to partner with at Ripsy. And I think once we have a full integration where you can sort of click a button to record and it pre-populates the note, then it will definitely be a time saver. And I know it's a time saver for some of the other clinicians in our practice. But right now, having most of the AI services are not built into EHRs. So you have a separate kind of login for your AI service. You have to copy and paste stuff over. You have to review it for validity because there are some serious problems that come up in the notes, which I think will get better with time. So between all the time of doing that, I'm tend to be very fast at doing the notes. So it is. I feel like it's a wash sometimes, but because I love technology and and AI models are trainable, I do feel like it will continue to get better.
Yeah, it's an interesting thing because I think the EHR industry, I think if you look at really any EHR company, one of the biggest value propositions that they try to pitch is, completing your notes quickly or, saving you time to make sure that you can just focus on patient care, which is ultimately, that's what a Scribe service is. That's the problem that a Scribe service is trying to solve in and of itself. So I think, but the EHR companies make that kind of claim as part of their value proposition without incorporating any kind of scribe. So they're already designing their systems to make that as fast as possible. So an AI has to, I think, really shave time off and not just be kind of like another way to do this that still takes you the same amount of time, if not more time.
Yeah, and I think there's other, as in Ripsy, we have a copy forward section because sometimes mental health visits, a lot of stuff stays the same. Mental status exam, patient to patient, tends to be the same. Assessment, the first paragraph tends to be the same. So we do have this blanket copy forward. We have a tool in place where you can sort of audit notes and make sure people aren't blindly copying things forward. But I think the big risk with AI is if people are really busy or if you forget to review something and AI puts in a comment that is nonsensical, it's perhaps even worse than you blindly copied forward from the last note type of situation. So regardless of what technique you're using to be faster, don't cut corners on what's required in your documentation.
Right. I mean, this is why you're required to review the note and sign off on it before you are done. Okay, so this is interesting. So we've kind of shifted towards talking a lot more about AI, but it's turning into this conversation of like, is it better to have an AI scribe or is it better to have a person like present in your session as a scribe? It sounds like right now the feeling is that maybe AI can help speed up the note writing process as it is right now, but it's not. I think it's not exactly solving that problem of having a human being there to write that note for you, because at the end of the day, you still need to write. I mean, you still need to like write the note in a sense when it comes to the AI. Or I don't know. Maybe it's a confidence thing. Like you're more confident that the note's going to be a bit more correct. Maybe you need to spend less time reviewing it when a human being whose job it is to be the scribe wrote the note, as opposed to the AI, which can be a bit variable. I don't know. What do you think?
Yeah, no, and I think, if you work with the same scribe most of the time and you get to know the styles, I do feel like you're going to feel more comfortable in that situation. That being said, AI models are trainable, and so I could see where the same way you get used to your human scribe working for you, that hopefully you could get an AI model that you begin to get very comfortable with or know where it fails. And I do think in this conversation about, I will say in general that, for mental health visits, where it's reasonable to maybe have a scribe for a brief medication visit, it would feel odd to have a scribe there during a psychotherapy session.
Okay, I was thinking about that. Okay, I'm glad you said that.
Yeah. And I've actually never seen a live scribe in even a psychiatry or a psychopharmacology visit. I would say also in general, writing a more clinical note, like a dermatology visit, a primary care note, those are going to be easier for a scribe or for AI to do a good job on. I think for psychiatric visits, we've been using several different AI services, and there are some times where, if I'm doing a session with a 6-year-old kid, there is some content in there, but it's intermixed with a lot of playing and making balloon animals or other conversations about sports, and that can really wreak havoc on your AI model, where at times where it says this is not a clinical note, and then you have to go and train it and address that. So I don't think the live scribe is going to work in general for mental health practices. And then, so I do think we're left with this, the AI model is the way that we're going to have to go. And it's sort of fun. What we're experimenting now is how well can we train it to take a 45 or 50-minute therapy session and condense that into a nice clinical note.
Yeah, this is really, really interesting because it's making me think about how psychiatry and just counseling, mental health therapy in general is a bit less concrete in we're talking about kind of like human relationship, mental health, just mood issues, which can be very kind of amorphous and fluid, whereas something that is wrong with my, liver, for example, there's kind of like hard and fast scientific rules of like what might exactly be going on with that might be easier for those models to be trained on those types of issues for different types of disciplines. But yeah, I think with this being such a fluid kind of field in terms of the problems that somebody might be having, it's probably the difficulty for training an AI model is probably a bit higher.
I agree, and we've seen some very impressive notes, and then we've seen times where the AI generated note has missed huge, very relevant pieces. And that's where sometimes the time saver is not eminently noticeable, but the idea is that you can put the effort into giving new instructions to the AI model and trying to help it do a better job.
That's good. That is good. All right. Well, let's see what we can talk about. We've covered so many of our questions just kind of naturally here. So just reviewing over here.
You have a good question there about determining if you should use a Scribe service. Or,
I do want to get at that. Yeah, Scribe service versus, or sorry, were you going to say Scribe service versus like having a human being or versus an AI, or a Scribe service versus not having one? Or sorry, what were you going to say?
Yeah, maybe all of that. And I do think there still are some of the speakerphone Scribe companies, so that in the context of a mental health visit, it's unlikely that a small group practice or even anything outside of a large health system,
right,
that it would be practical to hire a live Scribe, even if you're just doing medication visits and it felt okay.
Right.
So that sort of leaves you with the option of the speakerphone, someone listening in to write your note, or an AI model. In general, the AI models are going to be the cheapest right now. There are a lot of companies that are roughly in the $80 to $150 per month range for providers. And so, the question is, and every company, I believe, has a free trial. So it is this provider specific experience that is it helping you by saving time or making your job easier so that expenditure is worth it? I think that the pricing we're seeing for the AI models is, very low now at the start, and I'm sure that it's going to go up higher as the industry matures. Mm-hmm. So I don't think that the prices will stay this low. But I do feel like this is the wave of the future for clinical notes. And I as such, then my feeling would be that whether or not you decide to implement one right now, it is worth doing the free trial or learning more about it, because soon it will be more ubiquitous and there won't be some of the similar questions and concerns about patients of having your sessions being recorded.
Yeah, with AI kind of coming onto the scene, I believe it was late 2022, or at least commercially available AI coming onto the scene. We're all just kind of still figuring it out. I think every type of business is trying to figure out what are ways that AI can be incorporated into their workflows? What kinds of tasks now become obsolete, like writing a clinical note when applied to this industry, like writing a clinical note would be one of those things that there's an opportunity for the AI to be doing the work. But then when it comes to like actually receiving the treatment for mental health, that seems to be, we seem to, hopefully, the marker seems to be leaning towards like we still need human beings for that. So, yeah, it's just been interesting to watch. But I agree with you that I think the AI is definitely here to stay. But I definitely think that how it will continue to apply is with speeding up the note writing process or getting more accurate with writing notes so that you just don't have to worry about that and you can just focus on being a provider, as opposed to the AI becoming the provider itself. Hopefully I don't, eat my words on that one in like 10 years, but we'll see.
I don't think so, but you never say never, I guess. And I think that's your question about, there's a question about reducing provider burnout,
right,
and improving the quality of care. And I think those are very tied together, that I don't necessarily see in mental health having it, some of the AI services will kind of prompt questions or things to ask about. I don't see that as being, I see that as being very helpful in other fields, or as maybe like, hey, don't forget to ask about this medicine or something to that effect. I see that the real gain in quality of care comes from if we know that anyone who has to write clinical notes, it's the bane of their existence and their least favorite thing about their job. So if we can remove that or make it not as onerous, then the clinicians are going to be happier. And then when they're happier and less burnt out and feeling better, they're going to be providing higher quality of care, because people who are happy in their jobs do that.
Mm-hmm.
And I think that's where the real advantage of anything that can take that writing the note burden down a level is where we can see the payoff for patients.
Yeah, on that thread of questions that might be good to ask for you as a provider, would it be useful if your AI or your AI that's within some kind of system that you're using says like, oh, you're about to go see Johnny, remember to ask him about how his engagement went, or something like that, like something that was written in your note, some kind of detail that you said, like, patient is worried about proposing to girlfriend or something, and then the AI says like, hey, by the way, upcoming appointment, might be good to ask about that. Was that something that would be useful?
Oh yeah. And Parker, that's like, I know for myself, I always go to like review I try to put those reminders in for myself in the plan for the patient. So I'm always going back and hopefully have time to glance at the last session and remind myself of those things I was supposed to ask about or follow up on. And there are the AI models that will pull that stuff out and sort of have that laid out nicely on the screen to remember that, which, that was, those are the sort of like, oh, cool. Yeah. Of course, are they seeing that because I wrote it in the plan? But still, like, to have something set up with that reminder, it is, can make you a little bit better provider and save you time and, helping you follow up on things that you wanted to follow up on.
Okay. I think it's a pretty good use case. I feel like we've identified. I don't know if your human scribe is going to remind you of the same things, but
Correct.
One leg up on the AI.
They have and I don't think this is on our question list, but there's sort of some things that are very exciting about AI, and there's some things that I'm curious to see what's going to happen. Because what's happening now for the medical records is that we're recording audio transcripts of all these visits.
Right.
And then those audio transcripts are being conformed into written transcripts. Mm-hmm. And then the AI goes through the written transcript to generate the note. the very exciting piece for research nerds like us is having full written transcripts for mental health and therapy sessions. We could do some really interesting, tied with mental health outcomes, we could really do some revolutionary research projects on efficacy and styles of therapy. There's all this stuff we could do on, what percent of the session was cognitive behavioral therapy, what percent was mentalization-based therapy, what percent was psychodynamic principles. It is just, there are so many intellectually stimulating and potentially revolutionary ideas from a research perspective that I'd say that's what's very exciting to me. And we're at Ripsy, we're definitely gonna, as part of this process, store those written transcripts, and we will be cranking out research to try to help this field. The cautionary, or what hasn't happened yet, but I'm sure it will happen soon, is, and maybe less in mental health, because in general, child psychiatry and psychiatry in general are not high lawsuit fields, but once you start having full audio conversations and full written transcripts of clinical visits, lawsuits used to just look at the clinical notes. Mm-hmm. Now the lawsuits are going to be able to subpoena audio transcripts and whole written transcripts of sessions. And you can just see something where, hey, let's not do a mental health example, but hey, Dr. Jones, you said that you definitely did an exam of the right leg and didn't see any broken bone, even though a week later the patient had an x-ray and the bone was broken and they had to have their leg amputated. Then that you could see the lawyers, let me see the written transcript, and they could go through the whole written transcript and indeed prove that the clinician's note doesn't match what really happened in the session, and it gives a whole new layer to different malpractice lawsuits. So part of me is wondering, I'm waiting to see the first subpoena rule around, medical records are able to be subpoenaed. Are they going to be able to subpoena full transcripts or full audio recordings?
Right.
I'm waiting to see what happens there.
So yeah, I mean, the way you're phrasing it, it sounds like it's something that is likely inevitable, but with that inevitability, is that something that frightens you, or you think is good for just patients, or I don't know, how do you feel about that?
Yeah, I mean, it doesn't necessarily frighten me as a practitioner, because I work very hard to be truthful,
right.
Truthful in our records, and I've always, we've always tried to push on training people to do their notes to be accurate. Don't bend the truth. If you didn't ask about it, it's not a big deal. Just always be very honest.
Right.
That being said, we live in the most litigious society in the world. And California, we're a little extra protected from frivolous malpractice lawsuits, but that's not true in other states. And so it does, if it's another tool that can increase litigation, which just tends to reward lawyers and drive up healthcare costs, then that's not a good thing. That it might be a fun. Maybe I can reach out to one of my lawyer colleagues, and it might be a nice thing to have a legal expert chime in on this. But
yeah,
those are where my brain goes for these like Orwellian future changes.
Right. Wow. Okay. Well, anything else that we feel like we didn't cover on Scribe services before we move on?
No, it's been a really fun conversation, actually. And I think, Parker, what we'll do is, when we announce who we're partnering with and why, and have that built in, let's do another episode and maybe talk a little more specifically about what we're seeing after we generate some use data and how it's helpful or not as helpful as we think.
I agree. That would be really cool. And you got me very excited when you were talking about that research earlier. You're like activating a part of my brain that's lied dormant, and got super excited. So yeah, very cool. Very cool. All right. Well, do we have a mental health business moment this week?
We definitely have a mental health business moment this week.
Very cool.
Well, cool to have something to talk about, but not a cool business moment. So,
okay.
There's a law in California where you have to. It's a good law. It's designed for insurance companies to have to prove that the people they list on their panels are actually active and real. But the way this is played out is you can log into an online service and then go in and acknowledge, here's places you practice or don't practice, here's your NPI, National Practitioner Identification Number, etc. And for years, like the nonprofit has been listed all over the place with things that aren't fully accurate, and it has like 7 duplicate listings. So finally, when I was doing this, I'm like, I've always been worried about actually fixing it because of, and I should have trusted that feeling, but I decided, let me go in and clean all this up and correct the addresses and remove all these duplicates. So I spent a long time, okay, this is a duplicate, let's remove it. Why are you removing it, etc. And then I felt pretty happy to have it down to the right entries and the right addresses. And then the next day got the email, we see that you're no longer practicing. We're terminated, we will go ahead and terminate your insurance contract. And we see that this provider is no longer at this address. We will go ahead and terminate them. And it was panic setting in. And it's with these not well-designed systems with duplicates and canceling it, and then probably automated messages to insurance companies without realizing, no, this was a duplicate. And so I've managed to reach out and hopefully undid whatever damage happened, but now I'm just waiting for the next mental health business moment of the week with all the claims from the insurers being denied because they say you've closed. But that is the frustrating business moment of the week.
That sounds incredibly frustrating. And also not all that surprising that something that seems like something that sounds like it just shouldn't be happening, because there are records of these things did happen. Sometimes you think that these high-scale systems of insurance, or sometimes even the government, are well organized and keeping track of things, and next thing you know, something like that can happen, which is frustrating, but unfortunately all too common.
Yeah.
Well, on that note, I think it would be a good time to end the episode. So I will go ahead and close out with just informing the audience that we are so happy that they listened to this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you do have any questions you'd like to send to us, please submit those to us at sitandstay@RipsyTech.com. We may answer those in a upcoming audience Q&A. And if you're interested in featuring as a guest on the show, we've had 4 guests now, and we have just loved it every single time we've had somebody. We'd love to have more. So reach out to us at sitandstay@RipsyTech.com if that's something that you're interested in. And we will see you next time.
Very good. Thanks, Parker.
Bye, Tom.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.